Well, just this week, there has been a new round of intense fighting on Capitol Hill over the costs of this health care law. And it was exactly 12 months ago today that former House Speaker Nancy Pelosi said this about that law.
It's going to be very, very exciting. But we have to pass the bill so that you can find out what is in it away from the fog of the controversy.
Well, my next guest says Americans now know what is in it, and they do not like it. He is a vocal critic of the law. He says it's unsustainable, unaffordable, unconstitutional, and should be repealed. Tell us how you really feel, Senator John Barrasso, also a doctor of Wyoming. Senator, here we are 1 year to the day after Nancy Pelosi said that, and you say the past year has brought a string of broken promises.
Absolutely, Megyn. This is bad for patients. It's bad for providers, the nurses and doctors who take care of them, and it's bad for the taxpayers.
But get specific. What specifically are the promises that were made that have been broken?
Well, number one, the president said if you like what you have, you can keep it. Now we know that 80% of people that get their insurance through small businesses aren't going to be able to keep what they have if they like it. The president said families will note their premiums going down by about $2,500 per family. What we've seen is the premiums have continued to go up. This has not helped the quality of care or the availability of care, and it's going to make it harder for people to see doctors.
He also told the American people that he wasn't going to raise taxes once he got into office, and then when he imposed the individual mandate in this deal, he said that's not a tax. You say that actually turned out to be untrue as well.
Well, because he was on with George Stephanopoulos, and he had said it wasn't a tax, but the folks that look into this, now his own Justice Department, are arguing in court that it is a tax. That's the way they're trying to say that the individual mandate, the mandate that everybody has to buy government-approved insurance, is legal. That's their argument. And 26 states, as you know, have now sued the federal government. Judges have ruled both in Virginia and in Florida that this is unconstitutional because the government shouldn't be able to come in and say you have to buy a government-approved product. One
of the things the administration was trying to do, other than save costs on health care, which their chief Medicare actuary called some significant doubt onto, as you heard in Trace Gallagher's report, saying, as to whether it will bring down medical costs. He said, I would say that allegation is false, actually, more so than true. And as for people getting to keep their coverage, he said, well, it's not true in all cases. But separate and apart from those goals, Senator, the administration wanted to sort of streamline the health care red tape and just the red tape in Washington that you have to go through in general. And now, I don't know, has that happened in the medical field? Because we heard reports this week that it certainly hasn't happened at the IRS or the Department of Health and Human Services.
Yeah, the IRS wants thousands of more agents and bureaucrats, so does Health and Human Services. There's a story in the Wall Street Journal today about a pediatrician who is being overwhelmed with paperwork and prescription requests because of the new law, the impact it has on pharmacies around the country. And look, the secretary has now given out over 1,000 waivers to over 2.5 million Americans to say, okay, the health care law doesn't have to apply to you. And many of these people getting the waivers, almost half of them, are union members who lobbied for the health care bill in the first place. And now they're saying, hey, we don't want it to apply to us.
What, I have to run, but I have to ask you, so where do we stand? A year later, the polls show that the American people still dislike it more than they like it, still favor repeal more than they don't favor repeal. And we'll get to that with Scott Rasmussen at the top of our next hour with some new polls. And yet there doesn't seem to be any legitimate option for repealing the law, and people have cast a lot of doubt on whether the Congress can actually defund it.
Well, I have introduced legislation along with Lindsey Graham that says give states a choice. It's called the State Health Care Choice Act, and it allows states to make a decision if they would like to opt out of this mandate on their citizens, that the citizens have to buy insurance, that the employers have to provide it, and that the states have to live under this huge Medicaid mandate. It is breaking the states, and governors from Jerry Brown to Andrew Cuomo in New York to my governor, Matt Mead in Wyoming, none of them like these Medicaid mandates, Republicans or Democrats, and that's what has such a huge impact on the state budgets. We need to let states make decisions and opt out of this unconstitutional law.
Senator John Barrasso, thank you so much for coming on with your perspective.
Thanks, Megyn.